guys, it's Dr. Bailey. So today we're going to talk a little bit about sudden infant death syndrome precautions. Now we see a number of new babies every year. And when we're in our new parent visits, we have to talk to them about all sorts of things, including baby care. We answer baby questions, but the most important thing that we discuss is SIDS precautions. Why? Because you work so hard to get your babies here, and we're here to try to keep them here nice and safe. So come on in, let's talk about that today. So, with regards to SIDS precautions, there are a number of things to really be aware of, and I want to go through that list. So, first off, in terms of age range, we want babies to stay in their parents' room from 0 to 6 months of age. All the way up to 12 is great, but at least minimum 6 months of age. And what that means is that the baby should be in your room in a separate sleeper. So what does that mean? A co-sleeper, a bassinet, or a crib. Now, all of the surfaces have to be absolutely flat. Inside of each crib or bassinet or co-sleeper, you also want to make sure that there are no bumpers. So bumpers kind of sometimes come with the crib kit, and it's like a little liner and everything around the crib or bassinet. Do not use that. No loose blankets. You only want the baby to be swaddled, and no loose toys or any other objects that the baby can choke on as well. So now in terms of everything else, you want to make sure that there's no smoking in the household. And what that means is absolutely no smoking tobacco like cigarettes, no smoking any other forms of smoking, and no vaping, really. Nothing like that. If you absolutely have to, and I really have to say, please don't. If you're smoking, I need you to at least try to seek treatment or stop, because we really don't condone that with infants. But if you absolutely have to, you have to change your clothes, because again, when you smoke, when you vape, all of that particulate gets on your body, gets on your clothing, your baby breathes that in, and that can also lead to SIDS, an increased SIDS risk. Now, in terms of body temperature, it's really hard for babies to regulate their body temperature. And in SIDS, you don't want them to be too hot or too cold. So really what you have to do is look for signs and cues. So if the baby is like really red, sweaty, then it's most likely then they're overheating. If that's the case, then you just want to remove some clothing, remove any like swaddles and everything, and then just expose them to air. If they're shivering, then obviously they're too cold. Now, for infants, the largest part of their body is their head. So what you want to do is put a hat on them, because that's the way for them to maintain their body temperature. Otherwise, a lot of heat is just dissipating from their head. Their head's the largest part of their body. They're going to end up shivering. So if you have to choose between hat and socks, even though you shouldn't have to, and what to put on first, put on that hat to help regulate the body temperature. It will be more effective. So now you also want to make sure that the baby only has one extra layer of clothing on than you all do, or one less layer of clothing on than you all do at most. And then you also want to make sure about this one other thing that we're going to talk about, and we're going to get to that in a second. But I will say that when we're talking about this, parents, before baby comes, we want you to be up to date on vaccines. We want you to get proper prenatal care, because those things all help reduce the risk of sudden infant death syndrome. We're sure that, again, there may be some cardiac issues. We're not sure if it's like lung issues. It could be just a culmination of things, but you want to make sure, that everything checks out with your baby and that your baby is really in good health before they come home from the hospital. All right, now we're going to get to that one thing. So we've talked about all different types of SID precautions, but one of the most important things that you have to think about when you're looking at your room is making sure that you don't place your baby's crib under or above the air conditioning vent or heating vent. It is so important because you have to make sure that that ambient temperature of 72 degrees is really throughout the room. So the way to make sure that your baby isn't getting too hot or too cold is to make sure that they're in an area that's really getting the same temperature that you all are getting. And again, as we said, infants have to stay in their parents' room for a minimum of 6 months up until a year. So it is so important for you to really make sure that your baby isn't being affected by these temperature variations. All right, guys, for more tips and tricks, please go to our website at www.askpeds.com or check us out on Instagram, TikTok, and of course, YouTube. Take care, guys. For more tips and tricks for your child's everyday health conundrums, subscribe to our YouTube channel and go to our website at www.askpeds.com.